Nocturia, the frequent urge to urinate during the night, is more than just a minor inconvenience. It's a condition that disrupts sleep and affects overall health. Particularly prevalent in adults over 50, nocturia can lead to fatigue, decreased productivity, and even long-term health issues such as cardiovascular disease, a weakened immune system, and depression. But what causes nocturia, and more importantly, how can it be managed? In this detailed guide, we'll explore 8 practical and scientifically backed strategies to help you reduce nighttime bathroom trips and reclaim restful sleep. Stick around, as the final tips could transform your nights. One of the most straightforward ways to manage nocturia is by modifying your evening fluid consumption. Did you know that drinking too much water, or the wrong kinds of drinks, close to bedtime, can increase the likelihood of waking up during the night? But there's no need to compromise your overall hydration. During the day, your body processes fluids efficiently, but at night, reduced production of the antidiuretic hormone, ADH, causes your kidneys to produce more urine. This is particularly true for older adults, as natural ADH levels tend to decline with age. To minimize disruptions, limit fluid intake 2 to 3 hours before going to bed. If you feel thirsty, take small sips instead of drinking a full glass of water. Pay special attention to beverages like coffee, tea, alcohol, and sodas. These are diuretics that stimulate urine production. Experts recommend avoiding these drinks after 4 p.m. for the best results. A study published in the Journal of Clinical Sleep Medicine found that individuals who reduced their evening fluid intake experienced a 50% decrease in nighttime urination. This simple adjustment can make a significant difference. Now, let's move to our second strategy, leg elevation. If you notice swelling in your legs or ankles during the day, this could be contributing to your nocturia. The fluid that pools in your lower body while standing or sitting can re-enter the bloodstream when you lie down, increasing urine production. Elevating your legs allows your body to redistribute and process these fluids before you go to sleep. This reduces the amount of excess fluid your kidneys need to filter overnight. Start by lying down and raising your legs above heart level for 1 to 2 hours before bedtime. Use pillows or a reclining chair for added comfort. To boost effectiveness, consider wearing compression stockings during the day. These help prevent fluid buildup in the legs. Research in Circulation Research highlights that elevating legs for just 90 minutes reduced nighttime urine production by 25%. This practice is particularly effective for individuals with conditions like chronic venous insufficiency or heart failure. A smooth transition to our third tip, double voiding. This simple technique ensures your bladder is fully emptied before you head to bed, reducing the chances of residual urine triggering nighttime urges. Incomplete bladder emptying can lead to a cycle of frequent urges even if your bladder isn't full. Double voiding interrupts this cycle. Before going to bed, urinate as usual. Then, wait a minute or two and try to urinate again. You'll likely find that more urine is expelled the second time, leaving your bladder truly empty. A study published in the Journal of Aging Health found that double voiding reduced nocturia symptoms by up to 40%, especially in older adults with benign prostatic hyperplasia or decreased bladder function. Next, let's talk about diet. Certain foods and beverages can irritate your bladder, increasing the frequency of urination. Spicy foods, acidic fruits, artificial sweeteners, and caffeine can irritate the bladder lining, making it harder to hold urine overnight. Keep a food diary to track potential triggers. Aim to avoid bladder irritants like oranges, tomatoes, chocolate, and alcohol, especially in the evening. Instead, focus on an anti-inflammatory diet rich in whole grains, lean proteins, and non-acidic vegetables. A study in urology revealed that an anti-inflammatory diet reduced nocturia episodes by 30%. Incorporating foods like blueberries, kale, and quinoa can make a significant difference. As we transition to the fifth strategy, let's focus on bladder training. This technique involves gradually increasing the intervals between bathroom visits during the day to improve bladder capacity and control. Bladder training helps strengthen bladder muscles and improves their ability to hold urine, leading to fewer nighttime urges. Start by delaying urination for just 5 to 10 minutes when you feel the urge, and gradually increase this interval over time. Keep a journal to track your progress and maintain consistency. According to the Journal of Urology, bladder training programs reduced nocturia episodes by 40% within 6 weeks, offering a long-term solution to bladder control issues. Another critical aspect is evaluating your medications. Certain drugs, such as diuretics and antidepressants, can exacerbate nocturia. By adjusting the timing of medication intake, you can reduce fluid processing during the night. Speak with your healthcare provider about shifting diuretic doses to the morning or exploring alternative medications that have less impact on urine production. The American Neurological Association notes that timing adjustments for diuretics reduced nocturia symptoms by 20 to 30%, significantly improving sleep quality. Now, let's focus on daytime habits. Regular physical activity not only improves circulation, but also strengthens bladder muscles. Exercise prevents fluid retention and enhances overall bladder control, reducing nighttime bathroom trips. Incorporate at least 30 minutes of moderate activity daily, such as walking, swimming, or cycling. Add pelvic floor exercises to specifically target bladder muscles. The American Urological Association reports that active individuals experience 35% fewer urinary issues, including nocturia. Finally, let's explore the role of a consistent bedtime routine. Regulating your body's internal clock can significantly reduce nocturnal disturbances. A predictable sleep schedule minimizes stress and promotes relaxation, reducing the need for nighttime urination. Set a fixed bedtime and wake-up time, even on weekends. Incorporate calming activities like reading or meditation into your evening routine. Avoid screen time for at least an hour before bed to prevent melatonin disruption. The Cleveland Clinic found that consistent bedtime routines reduced sleep interruptions by 25%, leading to more restful nights. Managing nocturia involves a combination of lifestyle changes, dietary adjustments, and sometimes medical interventions. By following these 8 strategies, you can reduce nighttime disruptions and enjoy deeper, uninterrupted sleep. For persistent symptoms, consult your healthcare provider to explore advanced treatments or medications. With the right approach, better nights and brighter mornings are within reach.